News at 6.
A milestone has been reached in the state. More than 1 million North Carolinians have received a COVID-19 vaccine. Samiar Nefzi joins us live from the Greensboro Coliseum tonight after speaking exclusively with the State Health and Human Services Secretary Mandy Cohen. And Samiar, this was a long time coming and still a long way to go.
Yeah, Camilla, that's right. According to the Census Bureau, back in 2019, there were more than 10 million North Carolinians. And since the pandemic started, we've known that these vaccines have somewhat been the light at the end of the tunnel. And as we know, the state has been one of the worst when it comes to getting vaccines into arms. Most noticeable here at the Greensboro Coliseum when Cohen Health canceled upwards of 10,000 appointments. However, the Secretary of Health and Human Services saying that the state is heading into the right direction. The only issue right now, a major lack of vaccines.
It's a pandemic, it's a crisis, it's never perfect, so we have always room for improvement there.
March 3rd, 2020, the North Carolina Department of Health and Human Services announces the first case of COVID-19 in the state. From there, an invisible enemy would sweep across the state.
We have seen a lot of lessons learned from this pandemic. One of them is to make sure that we are letting science and data guide decision making, but it is also a consequence of the kind of infrastructure that we have invested in or not invested in, as the case may be.
Healthcare systems across the nation work to mitigate the spread of the virus as two companies, Pfizer and Moderna, work to push out a vaccine. On December 11th, 2020, the FDA issued an emergency use authorization for the Pfizer vaccine, followed by Moderna on December 18th. North Carolina would soon land in the bottom percentile of vaccine distribution.
I don't want to lose any more North Carolinians to this pandemic,
according to the Center for Disease Control and Prevention.
This vaccine arrived literally the day before Christmas. And so I think we got caught both. This was a timing issue, and it's also a new process issue.
State Secretary of Health and Human Services Mandy Cohen sitting down with us, explaining the state faced many hurdles.
Would you describe the vaccine rollout and the distribution plans? I mean, I think it would be fair to say, correct me if I'm wrong, in the beginning at least, that it was rocky.
Our country, our state has never undertaken something like this before, so it's not surprising it took us 2 or 3 weeks to really ramp up our operations.
On an average week, the state receives about 145,000 doses, which is then divided into 90,000 evenly throughout the 100 counties in the state. From there, additional doses will go to areas based off of population, like age, marginalized communities, and new providers.
The state is using a group system to prioritize those getting the vaccine, breaking everyone down in 5 groups. We started with Group 1, healthcare workers and long-term care staff and residents. Now to Group 2, anyone 65 plus. Coming up will be Group 3, frontline essential workers, followed by Group 4, adults at high risk for exposure and increased risk of severe illness. Lastly will be Group 5, anyone who wants the vaccine. The question still remains when we'll move into Group 3.
Not enough vaccine, which makes everyone unhappy. We all wish we could give every provider more vaccine to get vaccine out to their communities.
Cohen adding the AstraZeneca and Johnson & Johnson vaccine could provide additional support, saying the state has proven they can vaccinate accordingly, going from one of the worst in vaccine rollout, climbing to the 6th overall in getting doses into arms.
The supply is so limited. We had some backlog that is cleared now. And so now we are on a very limited supply week over week. We probably could administer 3 times the number of vaccines that we actually are getting from the federal government.
With the new presidential administration,
they have given us certainty for the first time over the next 3 weeks. So they have said, this is what you're going to get for 3 weeks. And they gave us a bump up. So we got about 15% more. It's not a lot, 20,000 more doses, but I'll take it.
Is there anything you would change, like giving it hindsight 2020?
Sure. Look, we're in a crisis, so you can't Monday morning quarterback a crisis here. But of course, there's so many lessons learned, even about how we came into this crisis and were we ready? Yeah, there's certainly lessons we want to learn and incorporate as we go forward. And I think it starts with what is that public health infrastructure?
Despite a year the secretary calls hard.
An honor of a lifetime to serve in this sort of historic moment for our state and our nation. But it's been a long year. I am certainly looking for the light at the end of this tunnel with all the vaccine efforts.
And as for the Johnson & Johnson vaccine, it is still waiting for FDA approval. That's expected to take place sometime later this month. As for the AstraZeneca vaccine, that's expected sometime in April. Now, we can report that the Greensboro Coliseum plans are still in the works to possibly make this a mega vaccination site. Of course, as those plans develop, we'll bring you the latest on that. We're live in Guilford County tonight. Samiar Nefzi, ABC 45 News.
Okay, Samiar, thank you so much for that report. Still ahead, 2 North Carolina deputies are recovering after